Hi, this is Sarah of Spa and Wellness Mexicaribe, and I'm here this morning with Dr. Ben Johnson of Osmosis Beauty, and we have a webinar about transformative skin health. Dr. Ben, welcome. How are you today?
Well, thank you, Sarah. I'm doing great. Super excited to be here. Talk about, obviously, I'm very passionate about our approach to the skin, and I hope the listeners enjoy it.
Definitely. I learned so much from our last webinar on skin mapping. I'm excited to see and learn what we're going to hear about today. I'm going to hand over to you, and then we'll rejoin at the end for any questions.
Well, that sounds great. All right. Let me share my screen. And well, welcome everybody. We're not too often that I have 30 minutes to communicate, so bear with me as I may end up speaking quickly. You can always rewatch it. I've been told, Sarah tells me they're going to record this and you can see it again. But I want to make sure to get all the information to you I can. Each time I communicate, I like to give what I consider to be really valuable knowledge in this industry of skincare where everywhere you look, it's hard to make sense of the marketing claims and what's truly happening in the skin and what I figured out along the way that I think has helped Osmosis really branch out. So, if you're not familiar with me, my name is Dr. Ben Johnson. I'm the founder, formulator, and CEO of Osmosis Beauty. We have skincare and wellness products. We have makeup products. But our true innovations are in the skincare and wellness category. So you've heard of me if you saw the last webinar where we were talking about skin mapping. Today, we're talking about transformative skin health. What does that essentially mean? Permanent change. I think this is a bar that has not been set by our industry, and we're trying to set the bar. We believe that there are what we'll call biohacks into how you communicate with the skin and how you stimulate it. And really importantly, how you work with it in a holistic way. I do not believe in any strategy where you're going against what the skin is trying to do because we're far less intelligent than our skin. Our skin is operating on AI level intelligence. This is proven by scientists year in and year out, yet they don't really emphasize it the way I want to emphasize it to you. Holistic has to be the way because your skin is doing everything it can to maintain itself, but it's coming against obstacles, roadblocks in order to do that. And so what we're trying to do at Osmosis to transform skin health is to bypass the blocks, overcome what we have, and truly create a permanent change. And so in order to do that most effectively, we do prefer that our professionals are using the MD line. It's a much stronger line than the retail line. It is only available through our professionals. And so it gives you an online advantage that is not seen very often in the world today. And we're really proud of these products and what they are capable of. And while I say MD, obviously this is not medical doctor only. In fact, one of the things I'll tell you, unfortunately, is medical doctors, I would almost argue 85% of them today are selling their skincare brand simply because it comes as a bonus to the Botox that they'd inject. And so they don't really have a passion towards skincare, and might argue even that they dismiss skincare as really being a value player in keeping yourself young. That's not what we believe. We created this professional line because we think that skin can be permanently changed. We have evidence of it in our before and afters, and anyone who's been on it for a while sees their skin progressively improve unless they're losing their fat pad volume, which is a thing that we can potentially address. I'm not sure if we have time today. So let's just jump right in and get started. There is a craze going on right now, and this craze is over exosomes. Once again, marketing has overtaken reality, but we're here to just tell it plainly and help guide you through the facts. And one of the things that I pride myself in is I never formulated based on what the markets were demanding. I always formulated based on what the skin needs. And one of the four categories that the skin needs as we get older is growth factor replacement. So all of us in our skin have a bunch of fat cells. Remember, the skin has this whole subcutaneous fat layer right below it. So all these fat cells are sitting there and they're contributing to the health of the skin by providing nutrients, by providing immune cells, by providing growth factors, and through the form of stem cells. And then blended throughout all of that is the circulation that goes through the skin that has been undervalued, in my opinion. Circulation is the number one problem for aging skin. It's not DNA damage. It's not free radical activity. It is circulation. And so what I mean by that is the comparison of my 58-year-old skin to my 25-year-old skin is I now have 33% fewer growth factors in my skin, or I would if I wasn't trying to address that shortage. And so every year of your adult life, which I consider skin to start going downhill, unfortunately for all of you, at age 25. So let me just give you the bad news up front. If you're over 25, you're on the downhill slide. And during that time, your skin loses about 1% of its circulation every year. And this, in fact, correlates very clearly with 1% reduction in collagen production. Interesting, right? Circulation goes down. Well, so does collagen. And then it also integrates with 1% fewer growth factors every year. 1% wound healing ability declines by 1% every year. So you see this progressive change in all these different factors of aging skin, and the primary player is the vascular system of the skin. Now, what actually causes the reduction of blood vessels over time, I don't know that that is fully understood. Certainly, excessive sunburns. I'm a believer in sun exposure, so I differentiate between a sunburn and sun exposure. Excessive sunburns leads to the collapse of blood vessels. Of course, diabetes, type 2 diabetes is much more common, and that leads to the collapse of blood vessels. So it's hard to say. Certainly, I guess our sugar habits could be involved. If you're a smoker, basically of cigarettes, you are going to have a much more rapid collapse of the blood vessels in your skin. Stress causes a vasoconstriction of the blood vessels in your skin, and we all operate on stress. And one of my podcasts, and if you're interested in what I have to say today, my podcasts are called hashtag Ask Dr. Ben. They're available on any medium, and ignore the fact that I took a year off. Go back and check out all the podcasts that I did. They're all timeless in their information and can be really helpful to you. So stress is the number one cause of aging, in my opinion. We don't realize the underlying stress of everyday aspects in our lives. But then, of course, there's dietetic stress, because the food that we're fed is so horrible, so inflammatory, so toxic that it also creates a level of stress. And we like to blame things like cortisol, go, oh, that's the bad player. The cortisol is doing the AI brilliant thing it was supposed to do every time. Insulin, the same. All those things are doing what they're supposed to do. The problem is the toxic exposure and the emotional unrest that creates these aging events. So we're coming all the way back to Stem Factor MD, which is our growth factor serum. How does it work? Well, essentially, growth factor serums are not human tissue. That's why they're not FDA regulated. Now, if you take stem cells, which make growth factors, or you take fibroblasts, which make growth factors, and you put them into the body, that's illegal. And in fact, people go to Mexico for that, where it's not illegal. But when it comes to putting things on your face, also injecting stem cells or injecting fibroblasts, which I honestly haven't heard, that's latter one, those would also be illegal. But the use of the excretions of these cells, which are called exosomes and growth factors, and I'll explain exosomes in a minute, those are highly beneficial. And as I mentioned, starting at age 25, you start to see fewer and fewer of them. And so what distinguishes all the different marketing brands that are out there that offer exosomes or growth factors is simply an easily detectable, and that is the numbers. So you go into the numbers, you say, okay, skincare brand, you've told me that you've got the best stuff because you use platelets, or you've got the best stuff because you use bone marrow stem cells, or I don't really care where you tell me you got your stem cells. To be honest, the research supports that all the stem cells have a similar potential. I personally believe we use subcutaneous fat because the stem cells that are closest to the skin are more likely to already be programmed to make growth factors related to the skin. It's a really logical approach. And to me, it's the best. And here's why we know this. We actually did the measurements. We measured the numbers. The first thing you want to check with every brand is, well, how many growth factors and cytokines, which is another type of term for a growth factor, or peptides, how many different of these identifiable things do you have in your serum? Believe it or not, this is calculatable. It's a study that can be done. And I would think every person who's making stem cell growth media is doing it at some level, one or another. Now, not all of them are showing it, which tells you they must not be competitive. So the first thing is, well, why won't you give me those numbers? Like, how many different growth factors do you have? And, what's the protein content per milliliter? This is another important measuring thing for me. I had the choice to pick between a lot of different labs, and I chose a lab that clearly was doing it right, because we have the most diversity of growth factors that rejuvenate the skin of any stem cell serum I've ever seen. I've looked for all the numbers. I ask anyone who asks me about another brand, I'm like, well, what do they tell you their numbers are? Because the numbers are undeniable, and we have over 600 different subtypes. So that's really important. And then the other count that's more important today, and mind you, we've been talking about our exosomes for at least 10 years. So this exosome story came up, and it's like, oh, it's something new. It's out of nowhere. Why haven't we been talking about this? It's not new. All the growth factors that a stem cell makes are most likely going to be wrapped in what's called an exosome. So all the exosomes that people talk about are made by stem cells or fibroblasts, or the other cell, for a little old school education, macrophages. So stem cells, fibroblasts, and macrophages will all make growth factors and cytokines. And so with Stem Factor MD, we have the most exosomes produced per milliliter of anybody in the world. And so you can get a special count of exosomes. It's a study you have to do. All these brands should be spending this money because they need to know. And so we have 3.5 trillion exosomes in a bottle of Stem Factor MD. A 30 ml bottle has 3.5 trillion exosomes. That's more than any other brand you're going to see out there. It tells a real story. Now, each of those exosomes is just a container, a delivery vessel for a growth factor or cytokine going into the skin. So in order to address your aging skin, one of the key components is replacing your growth factor population. Now, what makes this an interesting twist, but the research proves it out, is they never actually get into your skin. And this is a plus minus, because it gets a little uncontrollable if you start injecting growth factors into the skin, whereas when they absorb into your follicle and they activate receptors in the follicle, a similar event occurs. So it's a safe way to kind of keep any outside forces from coming in, and yet you're boosting your growth factor activity by delivering into the follicle. And they did the research on, does it actually work when it goes into the follicle? And the answer is yes. They found that these rejuvenation patterns were accelerated by the presence of these growth factors inside the follicles. So hopefully you followed all of that. And what are the benefits of these growth factors? Well, they stimulate collagen, elastin, fibronectin, laminin. They actually have within the serum those components as well. So you see a whole lot. Let's see if there's more on this. Yeah. And so you see a whole lot of different things that go in there. And some of the most important ones are things like fibroblast growth factor, vascular endothelial growth factor. So that's FGF 1 through 9 and VEGF. And why are these important? Because they stimulate new circulation. So the whole goal to permanent change is not just to plump your skin so the wrinkle looks better, because that's obviously not permanent. The goal is to rebuild the circulation in your skin so that you can maintain a higher level of collagen production, just like you did when you were 25. So you also see other things in here, enzymes, amino acids. All these goodies are going to be found in there, and they're all beneficial. You also saw in there RNA fragments. This is an interesting new category. We're actually messing around with formulations as it relates to RNA. And I know listen, I'm if you check out my podcast, you'll see I'm anti injecting RNA into your body, but RNA fragments do have a positive aging stimulus. So they're included in there, but I'm also looking at adding them in the future to other things. And so all these things are in this conditioned media. Everybody can produce conditioned media. They, like I said, from the placenta, from the bone marrow stem cells, from the platelet stem cells. And so the whole idea is go check the numbers and check their research. And so the other thing we did with stem factor is we tested it on cancer cells. This should be a huge issue right now with skin cancer rising. People should be trying to figure out, am I doing anything to make my cancer worse? Included in that category should be considered NAD increases. Like, so taking NAD, including in that should also be putting growth factors on your face, or of course, injecting them into your system. And so what we're finding, what we found in this study was we slowed cancer activity with our growth factor media. We didn't speed it up. You know, we're not curing cancer with it, but what I'm telling you is it's absolutely safe. Even if you have an undiagnosed skin cancer, you don't have to worry about it. And we also did other clinical trials showing that it's effective on aging, on activating certain DNA markers. It's really really remarkable. Now, stem factor, the non-MD version, has 2.8 trillion exosomes in it because it has fewer exosomes. So the 3.5 trillion is the MD version. And so it is slightly different that way, though they both use the same media. One just uses less of that media. Here's some example of the clinical trials. We don't have time to go through each one, but just suffices to say, these other companies, I'm not saying the clinical trials. Ours are long established. It's proof that the numbers that we're showing you are good and accurate. And I advise pretty much everyone over the age of 35 to start using a growth factor serum as part of their daily routine. I will add one thing, you know, we're playing around with making more products out of it. But honestly, like if you buy a growth factor serum, you don't need to buy the growth factor eye serum, because the growth factor serum did the job. You put it over your eyes, of course, it's safe on the eyes. So, it's kind of tricky how that works. And, a lot of people will use a stem factor in their scalp for hair stimulation. I like it. It's good. It's just not a miracle worker, and so it's expensive and it's not a miracle worker. So we're always upfront with you. We're going to say, look, it's going to be as good as anything on the market, but it's still, if you have the budget, sure. If you don't have the budget, that's not where I would spend your money. So let's move on to vitamin A serums, which are also confusing. And I just realized that I don't have a way to track my time. But maybe Sarah, you can pop in and give me like a 15-minute or in a 5-minute or something. Okay, so retinoic acid is the fan favorite of dermatologists around the world, honestly. And it's a curious thing because in reality, Dr. Kligman, who is the one who discovered, quote unquote, retinoic acid, actually loved retinaldehyde, which is the cousin to retinoic acid, or I should say the brother. And he wanted to use that, but it wasn't stable enough. So Osmosis is proud of our stabilized retinaldehyde, which is clinically proven to activate collagen equally as well as retinoic acid. That's right. In the skin, when you rub it on your skin, retinoic acid creates a certain amount of collagen. Retinaldehyde creates the exact same amount of collagen per amount. And what makes this even more intriguing is, retinoic acid is sold as 0.025, 0.05, 0.1. We go well above 0.1 in our Renew MD to give you, I think it's 0.165. So 65% more retinaldehyde than the highest level prescription. And we all know when you use retinoic acid, it causes irritation of the skin, it causes sun sensitivity, it causes skin dehydration. It actually wounds the skin. And there was evidence online 10 years ago that it caused DNA damage. Now, supposedly it repairs DNA damage. I don't know how that research disappeared and the new one showed up, but it's hard to trust sometimes what we're seeing in our searches these days, as you might agree. So, what is the secret sauce here? Well, you can see that most people use retinol, and retinol I honestly don't believe has any activation of collagen whatsoever. It's certainly shown to be 500 times weaker at stimulating collagen than retinaldehyde and retinoic acid. 500 times weaker. But even that, I would argue, is a misrepresentation because retinaldehyde, unlike retinols, most retinols, doesn't exfoliate the skin. And so exfoliation immediately triggers the skin to want to repair the epidermis. And when that happens, collagen is stimulated. So that stimulation that you see in retinol that's 500 times weaker, in my opinion, is to repair the epidermis, which is a temporary layer of your skin. So you can see why retinols, to me, they plump the skin because they wound the skin. They're in the skin the next day, even if you use it at night. So there's sun damage occurring, or I should say skin damage occurring when you go into the sun every day. You use retinaldehyde or retinol at night. Retinaldehyde is different. Retinaldehyde is stabilized, so it doesn't get oxidized by the sun. It's in a liposome delivery, so it is the best retinol story on the market. The most potent, non-irritating version of collagen stimulators you can find wrapped in a liposome, so it delivers 6 times more into the skin than unwrapped from a liposome. It's really a remarkable story. Our Renew, to me, is the highest value item we have in our line. When you look at the ingredients that we're using, and trust me when I say I use the highest percentages, if an ingredient has a recommended amount, I oftentimes will double that. In one case, I quadrupled it because I recognize that I'll just say it, chlorella. Chlorella is one of my favorite ingredients in our Renew. It's a collagen stimulator. It's a sun defender. It's a vascular stimulator. It's proven to increase the production of new blood vessels. So all of this can be found in this serum that has retinaldehyde. All of the ingredients are liposome delivered, which is a pharmaceutical level of efficacy that you just don't see in other lines. I have seen a couple of people try to copy me, and I only know this because their formula has liposomal retinaldehyde, liposomal chlorella, and liposomal niacinamide. I love niacinamide as well. The problem is the liposome they chose is wrapped in bone. And bone is not a liposome. It is good to stabilize something, but you imagine how good your skin as it is at breaking down bone. Zero ability to break down bone. So the ingredients wrapped in a bone are not bioavailable. Got to keep rolling. Okay, so here are the benefits to the skin. It's proven to be efficient and safe. It's sun safe. It's safe in pregnancy. It's safe in even what I want to say, compromised skin can often tolerate retinaldehyde compared to any other retinol. We make sure to design all of our products to support barrier health. So by not exfoliating, you automatically can increase the amount of anti-aging you can do. So you can imagine if you're somebody who's trying to push your skin to get younger, one of the things you were taught was, oh, I need to exfoliate as part of that routine. That is the wrong thing. Exfoliation dehydrates, increases sun sensitivity, weakens the skin. Weakening the barrier weakens the skin. That should be logical to anybody. When you step out of the books that we've been taught to read and just think about it, like, yeah, that barrier designed by God to be perfect and maintain itself perfectly, you tear it down, you're weakening the entire organ of the skin. So you have exfoliation, you got to get rid of that. Well, now with retinaldehyde, you can use it without exfoliating. You can push the skin, you can push the collagen production. It even is antibacterial, although I don't think that's a necessary thing. I don't believe in acne as a bacterial infection. It's increases the thickness of the dermis and the epidermis. And it's just truly amazing. So that's in our Renew. Also, and I mentioned it's liposome delivered. Most of our serums have a delivery system. And in the case of the vitamin A's and my Replenish, which is my antioxidant serum, they're all wrapped in this phosphatidylcholine. It's the purest liposome vessel known in the pharmaceutical industry. We use a very purified form of it. It comes from sunflower, and it is phenomenal ingredient, proven to reflect sunlight, so it actually has sun protection qualities. Lock in moisture is really good at temporary barrier protection, so it keeps your skin moist, and it delivers 6 times the amount of ingredients into the skin, as you see by this image here. So love this ingredient. It's really expensive to use, and the products have a little tackiness to them when you initially apply it because of it. Please overlook that. I didn't formulate these products so they were white, smell nice, and creamy. I formulated them to get permanent change. And so people get accustomed to this. Well, they love this product. And why is it so lovely? Because it has 10% silicone in it. And so they're like, oh, it feels so good. It's like, it's the worst thing you could do, right? But yet we know that these chemicals, many of them that feel good, are either interfering with absorption or causing harm to the barrier, all those things. So this is our core four. We talked about Renew. We talked about Stem Factor. I know I have a few minutes left. Let's talk a little bit about Catalyst. Catalyst is our C serum. Let me see. Do we go into Catalyst here further? No. So Catalyst is our C serum, and this product is unlike any other product. It's patented. Also, the other one I didn't talk to you about is Rescue. Rescue is also patented, as you can see there. But Catalyst is the C serum that permanently reverses acne scarring. That tells you how powerful it is. We did clinical trials on it, and it actually caused broken capillaries to heal. That tells you how powerful it is. No other C serum does that kind of thing. And so we saw, 110% increase in elasticity. We even saw eyelids get tight by 15% in the clinical trial. And so for all these reasons, this C serum, even though it's a darker color, I can't go into all the depths. You'll have to go into some of my other videos to hear more about the C serum, but it's a darker color because what we're doing is we're causing all the amino acids I put in it, and it is packed full of amino acids. It made them activated. So in your dermis, when the vitamin C comes around to make collagen stick together, it activates amino acids in a process called hydroxylation. We do this in the bottle. And so it makes all the amino acids unbelievably potent. Things like you've heard about hydroxyproline, tons of hydroxyproline in this product, hydroxylysine, hydroxyglycine. You never see hydroxylysine and glycine in products because they're so hard to make, but we make it in the bottle, and that's why we reverse acne scarring. That's why we see permanent change with it, and that's all I can say about that because I'm out of time. So then we have Rescue, and Rescue has an ingredient that we make in our own lab called trioxylane. No one else in the world uses it. You can see a few research studies from pharmaceutical companies are like, this has promise for a lot of different things, but I'm here to tell you it is the best anti-inflammatory you will ever find. It is remarkable for toxic skin, so that's acneic skin, rosacea, perioral dermatitis, which is blowing up around the world. That is the best topical for that. It's not a steroid. It works as good at calming redness as a steroid, but it doesn't have that side effect of harming the skin, which steroids are terrible. They age your skin and they can cause withdrawal symptoms, as you probably heard about. So Rescue is unbelievable. So what I would tell you is I use all four of these serums twice a day, and everyone should do that twice a day. Push your skin as fast as you can. Add the Epic tool, which helps penetrate even more with the liposomes, and you will see dramatic results over the first 3 months, continuing to get better over time. And now we get to our supplements. How many minutes do I have? 5 or 10? You come in and tell me. Okay.
Yeah, continue. We've got, let's say, somewhere between 5 and 10.
Okay. All right. So our supplements are equally as groundbreaking. And I push aside the modesty because I can't describe to you the difference in how I formulate versus everybody else. Someone else might say, oh, we need a multivitamin because everyone takes a vitamin. Oh, we need omega because that's just part of a good strategy. And then they'll tell you to take NAD or magnesium or calcium. I am the opposite. I'm telling you, most supplements are either doing nothing for you or they're harming you. You don't need minerals in almost every case unless you drink reverse osmosis water all day long every day. You don't need minerals. You get it in your water and your food. You get all that you need. Your body's recycling all the time. Yes, you need, fats and carbohydrates and proteins, but as far as these other additional components, very few people need these boosts. Now you might say, well, wait, why does magnesium help me sleep better or poop better? And the answer is because you had broken things, and magnesium changes the body in a way that doesn't address why those things are broken, but it overcomes them with something that actually is bad for you. So most magnesiums are bad for you. All probiotics are bad for you. most multivitamins are bad for you. Like and how do I know this? I have a forum where I've done over 10,000 cases where we looked at the supplements and the meds of people. We looked at their facial pattern. That's what Sarah was talking about, my past talk about facial analysis. And from that information, I was able to learn, well, which ingredients and supplements are good or bad. And I formulated to clear skin problems. I did not formulate so I could sell you another supplement. Like I said, I don't believe most supplements are necessary, but you're going to find some of these are important to you. Maybe my little child fan favorite right now is recovery. I just, in fact, was doing I'm in the middle of fighting the patent office over this specific product right now. I think I'm going to win. Our arguments are strong. This product's unbelievable. It restores the fat pad volume in your face and in certain body parts that you hate. So let me just give you the quick skinny is as we age, there are specific fat pads in the foreheads, in between the eyebrows, over here, under the eyes, in the eyes themselves, around the mouth that shrink. They shrink because of smoking, because of drinking, because of stress, and because of severe low weight, exercise crazy people. So in all those cases, your body will steal from the structural fat pad, cause volume loss here in your neck, in your biceps, in your thighs, in your buttocks. So when you lose the volume pad in your buttocks falls. When you lose the volume pad in your arms become waggly. When you lose it in your neck becomes crepey. And when you lose it in your face, it's the 80% of the cause of your wrinkles. We have solved this problem. This oil, which I specifically designed when I realized the type of fat that are in these fat pads is different than the fat we think of that we hate. The subcutaneous fat is the fat we hate. That's the loose jiggly fat. These fat pads are the fat that we love, even though we didn't know they were there. And that's what we're trying to replace. So I use a very specific fatty acid blend that involves mostly using sea buckthorn, which is a superfood, which is a prebiotic, which is one of the more amazing supplements you could take if you're just trying to improve your health. Go look up sea buckthorn research on all the things that it helps in your health, and you'll be blown away. And then factor in the fact that I brought in the right components of sea buckthorn from the fruit, pulp, and seed in order to create the perfect blend of fatty acids to refill just your fat pads. Doesn't make you fat. It only refills the volume by about 80%. I can't quite seem to fill 100% of your fat pads, but we can go a long way. Really amazing. We also use a little macadamia nut oil because it also has the right fatty acid profile. But these have omega-7s. This is your omega. This is what you take every day to make your gut healthy, to make your body healthy. And so here are some, oh, wait, maybe we're not doing more wellness than that. Let's see. This is some examples of this is actually primarily doing facial infusions. But here's Regenerate. So Regenerate is a liver extract supplement, kind of. So first of all, I'll tell you that liver extract is a superfood. Again, one of the most beneficial health promoting supplements you can take. Personally, you'll never catch me eating liver, but I can take a liver pill. And so what else I put in this that makes it special is alpha ketoglutarate and a bunch of really unique ingredients that help heal the liver. So what this is for is to heal your liver spots, which come from the liver, to help you heal melasma, which comes from the liver, and to help you build collagen. I know everyone thinks they should take collagen supplements, but one of the things I came across in my research was collagen supplements are one of the main causes of this perioral dermatitis epidemic, and you should never take a collagen supplement because of the way collagen is treated. By the way, the amino acids in most of those products are not even the same profile as your skin. Whereas in Regenerate, I put all the amino acids in there that your skin might need a booster on, and then I put in that AKG. And when you look up the research, and you can see it on our website about AKG, that's like sea buckthorn, that's like chlorella. It's like, wow, how can one thing do that many different benefits? I love AKG. It's in the Catalyst, by the way, the C serum. It's in Regenerate as an oral, because when they showed, and a lot of people, they take vitamin C. It turns out you should never take more than 250 milligrams of vitamin C a day. When they take vitamin C, their collagen production does not increase. When they take AKG, which is plentiful in Regenerate, their collagen levels did increase. It is an unbelievable component, and this product I love. And so it's for rebuilding wrinkles. It's for repairing your liver, which, by the way, needs all the help it can get in this toxic world. And I don't just mean cleansing your liver. Some people take dandelion or milk thistle and they're like, oh yeah, for liver health. I'm talking about liver repair, where we actually see the liver enzymes change as a result of taking that supplement. It's unbelievable. All right, here's some examples of liver repair that you can see as one of many examples. Oh, we did hit it in time, so we weren't talking about every wellness product. So I'll just finish by saying the wellness products that we have to offer that we didn't mention include frequency elixirs, which is an absolutely mind-blowing invention. I didn't build the box. I came up with the formulas. It's frequency. So the actual bottle says water, but it's imprinted with frequencies. No question, once you start using them, how well they work. We treat pets. We treat infants. All those could, there's no way you could have placebo effect in an infant or pet because they have to believe the product's going to fix them in order to be placebo. So I'm just telling you, this is the product that we sometimes get an eye roll from, and yet it's my favorite one. In fact, our immune defense, which is kills all pathogens. So if you have mold, if you have, I was just talking with someone the other day where they're like, oh, my doctor's worried about all the mycotoxins in my body. And I'm like, the mycotoxins aren't the problem. Yeah, they're, you want to get rid of them. The mold that's still in you is the problem. And for some reason, doctors don't realize that when you get exposed to mold, it's now growing in the body. And so immune defense treats that, whereas these mycotoxin detoxes, do very little. And if you don't kill the mold, the mycotoxins stay producing, right? And so it also kills viruses. It helps with vaccine injury. It helps with autoimmune disease because most of them are caused by a pathogen. You can't believe the spectrum of things that we're treating with immune defense. And finally, I'll end with our skin clarifier, which is our mucus melter, because many foods in your diet, if you do a lot of dairy, fried food, then you are building up mucus in your body. This causes allergies. Mucus from your food causes allergies in the sinuses, but it also causes skin congestion, just like you have congestion in your sinuses. So for this reason, skin clarifier is a critical part in treating rosacea, perioral dermatitis, acne, and it's another patent pending supplement. I have several patent pending supplements out there. So again, like you can see, we do it different. We're not formulating to match what the audience seems to be looking. We're trying to teach you what you need in order to keep your skin clear and in order to keep your body detoxed. And so I hope all this was helpful. And with that, I'm gonna shut my mouth.
Thank you so much for all that amazing, incredible information.
Yeah, thank you. Thanks for having me.
That was wonderful. So we can see the website details and contact details here on the slide, on the final slide.
Yeah.
So if people want to take note of that. And then if we stop screen share, we can have a chat and go through some of the questions.
Oh, that would be me.
So one question is, which, if any, of the serums can be used with a dermapen?
All of them. We highly recommend it over other serums that might be more toxic. Remember, when you have a pen, the skin still wants to close up. Like the skin is not this rigid, like cardboard box thing where if you poke a pen in it, you can look through the pen hole and see. As soon as you poke a pen in the skin, it's collapsing on the hole. And so you need liposome delivery in order to make that work. So I would use all the serums, the exosomes that have a better shot of getting in that way. The liposomes get in that way, and all the ingredients and the other formulas just have a better penetration. Now, I'll be honest. I think that the pen is inflammatory, and I'd rather use what we have as a Revita pen, which creates channels, microchannels, without actually wounding the skin. They only last for 30 minutes, but that's all you need in a facial. And so that's what I would prefer. But yes, all the serums would be recommended for the pen.
Okay. Another question is about the circulation. You mentioned that circulation is definitely important to consider. So therefore, is erythema always good?
No, it's a great question. There's a fine line between circulation that's good and circulation that is not. And I appreciate the question. How would I answer that? Erythema is good in the sense that you don't want to stop the erythema because it is the AI brilliance of the skin that's specifically opening up the blood vessels to heal that wound. Okay. When you have rosacea and you have redness, that's because there are toxins. My take on it, there are toxins in the skin from your gut that the skin is trying to deal with. It's like they mirror each other. So the skin mirrors what's going on inside the body. And so when you put ice on it, that's actually not helping, right? Because now you're reducing the healing that's trying to go on. Does it make it a little less red? It does, because cold causes a vasoconstriction, but that's not because cold made the wound better, right? So that's the difference there. It's a great question. Even broken capillaries, we call them broken. They're intentional capillaries made by the skin, designed to increase the circulation to an area that's been wounded so that it can heal better. So even capillaries are intentional. So you don't want to laser close capillaries if an area is trying to heal necessarily. And then where else do we see redness? So yeah, I guess I was, some would say, in fact, I would tell you all the heat devices that are out there, like the infrared and LED that are designed to increase collagen, all they're really doing is increasing circulation. There's not magically triggering collagen. The increased circulation helps increase collagen production temporarily. So that's how that works. So it's a great question. And the problem with if your skin is red from something going on internally, you're not getting younger in that situation because the skin is too busy battling a problem to focus on rejuvenation. So that's where I would say red skin, not a rejuvenating event, but certainly not something that you want to think of as bad.
Okay, and what if the erythema was caused by a product or a stimulation like facial massage? Would we consider that a good effect because it's temporarily increasing circulation?
Yes, from massage. I mean, if erythema has been caused by a product because it hurt the skin, that's bad, obviously.
Okay.
But as an example that you might be thinking of, we use niacinamide to dilate the blood vessels in our Renew. And when you put that in a facial, they can get red from that. And yeah, you can think of that like a Thanksgiving feast for the skin.
Fabulous. The next question is actually about red light therapy. What are your thoughts on red light therapy for the face?
Yeah, it's oversold, but it's just fine. I think where people are making a mistake is they think a little is good and more is better. And the skin will get heat damage from it. It's clinically proven to happen. And it's a fine line. You don't know which device and the potency of the device, at which level you're going to actually get heat damage. So there might be a red light where you should not get more than 5 minutes and you're doing 30, you're going to have problems. And people who are lying in light beds are seeing that. They sit too long in that light bed. And, while it's good to vasodilate, which is what the light bed is doing, once you get heat damage, you start getting hyperpigmentation.
Okay, so better using red light therapy devices that are not generating heat and not causing that heat reaction in the skin.
Use them modestly and don't be caught up in, this frequency actually stimulates fibroblast activity. Just remember that frequencies that heat up red, which red light heats up red, so that means blood vessels get heated up. They're going to create a benefit at a modest application, and it could be daily. Yeah, I think that's enough.
Fantastic. Thank you so much. Really amazing information.
Oh, thank
We've
you.
all learned so much. So thank you very much for joining.
My pleasure. It's good to see everyone, and we'll hope to see you again soon.
Thanks very much for watching. Ciao.